Hey Refam, my name's Kate and welcome back to Keeping It Real, the podcast that knows if you fail to prepare, you prepare to fail. Today, Kim and Richard join me to share their must-dos in the lead up to prepare for surgery, what common advice you should actually just ignore, and their top tips for making sure surgery goes as smoothly as possible. Okay, so I put on the Instagram story the other day, seeing what people wanted to hear about most on the podcast, and by far and away, prepping for surgery.
Great
Wow.
one.
And I was so sure we had already done that, and I went through and checked, and we hadn't. So
I feel like we have as well.
how to prep specifically for things, but not just to prep one. So obviously things might be a bit different depending on the surgery, but we'll kind of start general and then get more niche as we need to. If we assume patients already had their first consult, they've done all of that dance and they've booked in for surgery, what's the most crucial things that a patient should be doing in that time to prepare for surgery?
Well, obviously, if we've said you're ready for surgery, then patients will be at their ideal weight. I know we say it every single week, but being at your ideal weight, that's BMI at least under 28, hopefully even under 25. That'd be number one. Number two is just stay physically active. So there's a period of time after your surgery, regardless of what it is, where you're not going to be moving as freely. So you want to get as much exercise and flexibility and mobility, bank it up a little bit so that when it comes time for your surgery and you're a bit limited in what you can do, you're ahead of the ball, if you like.
I completely agree. And certainly if there's quite a gap lead time between seeing us and then the date for your surgery, don't do anything radical. And if anything does change significantly, please let us know and come back in. Don't wait to on the day, because I know we've both had patients that have shown up on the day of surgery where they were actually significantly different, both weight loss and worse, weight gain. And I know Richard's cancelled a patient on the day of surgery because of that. So no one wants any surprises. And when you've got a date in mind, don't let everything all just suddenly go out the window, because there are some things that we certainly will cancel you for.
Are there any specific tests or evaluations patients need to do before surgery?
So we've traditionally never really done many tests. Recently, we have started doing just some basic blood tests for patients having bigger operations, so combined procedures, so say an abdominoplasty and breast reduction or a body lift, or basically any combined procedure. But they're still very basic tests. We're not testing zinc or anything weird. It's checking your blood count, making sure that's okay, checking your liver function tests. Iron is an important one. Just because any operation you have, there is some blood loss. Even just in the tissue that we remove, there's some blood loss. And so for women, often if they're low in iron, then you need iron to make new hemoglobin. And so if you're low in iron, then that's challenged even more. So they're the basic tests that we do. We don't like to over-test, which some doctors do like to do. We like to use it very specifically.
How far in advance do they have to do those tests?
They're given the blood test form at the nurse consult, which happens around 2 to 3 weeks before their surgery date. So it means that those blood tests are as up to date as possible. A couple of other tests that we sometimes do, so would be an ultrasound for someone that's having an abdominoplasty or lower body lift. If we're looking at using the item number for that, which is measuring the rectus diastasis, so that's the muscle separation, and a mammogram for women that are having breast surgery in the usually 40-ish with risk factors, or 45 plus, but certainly making sure they've got an up-to-date mammogram if they're 50 and over is mandatory.
Do you have anybody who's either had a mammogram or just kind of routine blood test that's come back and it's impacted whether they have surgery or not?
I haven't, but yeah, like you certainly, if someone has an abnormal mammogram, you want to know about that before they've had surgery. I have had a couple of patients where they've had mammogram recalls. So it is important, if we do recommend getting that test done, that you get it done as soon as possible, because if there is a recall, there's a lead time, it takes a few weeks. And those patients that have been recalled for that, all of that has ended up being completely normal, but it took extra weeks. So one patient actually did need to have the breast component of a procedure that she was booked for delayed, and that's coming up soon because she hadn't had that test.
I've had a couple of patients who have found things on a mammogram and needed a biopsy. Recently had a patient who she had pre-existing implants in, wanted them removed. She'd had some funny pain. For some reason, I suggested we do an MRI, and the MRI found something, and that then had to go through a biopsy, and that was negative, and now going ahead with surgery. So as Kim said, important to get these done, particularly the blood tests, not so important because we would rarely change anything from them. Mammogram, try and get it done you can't get it done really too early, and the earlier you have it done, then it makes it easier if we need to refer you on for a biopsy or to see a breast cancer specialist or something like that.
Have it done before you see us, even better.
What about medications? I know we've talked about this, but might as well add it on. Is there anything people should start taking, should stop taking in that preparing for surgery window?
We generally wouldn't be saying start taking anything. If you've got a healthy diet where you're eating protein and plenty of vegetables and fresh fruit, then your dietary requirements should be fine. So there are a lot of bariatric patients in particular, so have had weight loss surgery, that are on multivitamins because they can't absorb all those things, but they would normally already be on those medications that have been recommended by their previous surgeon. So that's all fine. So generally there's a lot of voodoo and a lot of urban myth like take collagen, take this, take that. But really I think eating a normal healthy diet is going to be getting you everything that you need. Things that we do need to know about, whether you're taking any blood thinners, particularly aspirin, we would have asked all those sort of things at your original consult. There are a lot of non-prescribed medications, herbal supplements in particular, that are blood thinning. So we wouldn't want you taking those for at least 10 days before your surgery. They're probably the only other things that we generally ask people to stop before their surgery would be hormonal medications, so the HRT or the oral contraceptives, so usually stopping those about 10 days before surgery, because those medications can increase your risk of DVTs and clots. So
with HRT, it depends if it's a tablet or some of the other modes of delivery. So I think if it's a patch or cream, it doesn't impact the clotting so much. Yeah, the pill is an interesting one. The data is a little bit conflicted. It's not hard and fast. But the main thing with the pill is that around the time of an anaesthetic, for various reasons, fasting, antibiotics, it can often be ineffective anyway. So you need to use other methods of contraception anyway. So there's no real value in being on it. So as a general rule, it would probably be 10 days. But risk of DVT with this sort of surgery and the precautions we take, it's a little bit of a grey area. Generally, the recommendation would be to stop it, but there's other reasons to be stopping it anyway.
And all other prescribed medications like anti-high blood pressure medication for depression, anxiety, all those things, keep taking them. And can take them on the day of surgery as well with a small sip of water. Absolutely no problem.
Yeah. Outly on antihypertensives or blood thinners, that'd be pretty rare. But yeah, a lot of patients are on anxiety medications or antidepressants, and yeah, very important to keep taking them in the lead up. You don't want any sudden changes in emotional status and things leading into the surgery. So important to keep taking all of those medications.
What are some other medications you need to stop?
So all of the weight loss drugs do need to be stopped. I think it's now at least 3 weeks prior to surgery because it slows the emptying of the gut. So Ozempic, all of those types of medications, it slows the emptying of the stomach. So what that means is when you're being put off to sleep by the anaesthetist and they're putting the tube down, if the stomach is still full, there's a chance of reflux. So these rules, because these are pretty new drugs, these rules are evolving, and there's sort of ways around it, but it makes it a little bit riskier. At least 2 weeks before, to allow the stomach to empty, which means you can just have a normal anesthetic. If you are on it, or any of those drugs, Mounjaro, Ozempic, 100% just make sure the anaesthetist knows, because they will change the technique of how they actually put you to sleep.
What about a bit closer to actual surgery, like a day or two before? Is there anything that patients should be doing specifically in that shorter period to be preparing?
From a medication point of view?
Just in a preparing point of view.
Oh, yeah, lots.
I was gonna say,
Are we up to that bit already?
Chill out.
Well, I think chilling out's important.
Yeah.
I think that's important. But I think in the lead up, it's important, depending on what your social circumstances are like, it's important to get sort of everything in order, because you are, no matter what you're having done, even if it's a breast reduction or breast implants, you're going to be incapacitated to a certain degree. And so you don't want to come home from surgery and then suddenly have to go and do shopping, or you've got to go wherever to buy things for a holiday. So you just want to think ahead a little bit. Make sure there's maybe some pre-cooked meals, if that's your role, or delegate that role if you have to. Make sure you're not having to go shopping for everyday necessities, things like that. If you've got young kids, make sure sort of rosters are sorted out for pick up and drop off with school. And really, probably the last couple of days, you're probably getting a little bit late, but lean on family members to help you out. The recovery can be a little bit of, I was going to say Ferris wheel, but I think roller coaster. A little bit of a roller coaster. There's ups and downs, and you've got to focus on you. You're the one having the surgery. You've got to put everything into your recovery so that you get the best possible result. So as many things that you can delegate, offload, particularly for the first couple of weeks after, I think in the lead up into the surgery, that's a good time to be focusing on that.
And think about where you're going to be sleeping. If your bedroom's upstairs, and whether you are or not going to be going up and down the stairs, making sure you've got plenty of pillows, just simple environmental things like that as well.
What about the day of surgery?
Get a good night's sleep the night before if you can.
We are.
Yeah, exactly. Yeah, have it planned out, how long it's going to take you to get to the hospital, who's going to be dropping you off. Have all those things literally pre-planned in those days before. Get there early. Don't be cutting things fine. And again, just trying to be as relaxed as possible, because it's a choice that you're doing this. And generally when we see people when they arrive at hospital, they are in that excited, nervous point of view, which I always say that's a good way to be. But yeah, really, I think if you've got an afternoon surgery and admission time sort of midday or 1 o'clock, is probably worse, because you've got to fill in the morning where you can't eat or have coffee, all those sort of other things you can do to fill in time. So
what are the fasting rules for the surgeries?
6 hours?
6 hours.
I don't even know anymore.
It comes on instructions that you get, but it's 6 hours for food and clear fluids, I think, for almost up to the time of surgery, but small, like don't be guzzling lots and lots of fluid. So yeah, like clear fluids, usually water, but if you're feeling like your blood, feeling lightheaded or feeling like terrible, like a little bit of watered down apple juice, things like that would be fine.
Do patients get catheters in our thing?
Great question. Depends what surgery. So anything tummy related for me, so body lift or abdominoplasty, we do put in a catheter, and that's to make sure the bladder is not full, because when I'm doing my muscle repair, if the bladder's full, it's pushing on the abdominal wall, and so I can't repair it as tightly. Breast reduction, breast augmentation, liposuction, then brachioplasty, no catheter, but anything that has a tummy component, yes.
Is a catheter inserted while they're still awake or when they're under?
When they're asleep. So it is as soon as they go to sleep, generally that's the first thing that we would do. I'm slightly different. For abdominoplasty on its own, I don't put a catheter in, but abdominoplasty combined with breast surgery, yes, more because it's a longer duration, and lower body lift, absolutely.
So a day of surgery, is there anything people should, obviously they go in their hospital gown, but on the other side of that, is there like specific clothing they should be wearing so that's a bit easier when they come out the next day?
Oh yeah, I would say, look, just take minimal amount of clothing. So wear something really relaxed and casual, loose to hospital, something that's easy, like a hoodie that you can zip up without having to necessarily put it over the top of your head, some elastic waist, tracksuit pants, something like that, that are not tight that you're going to have to bend over and pull things up tightly. You definitely get changed on the day of surgery before you go into the operating room, oftentimes wearing some nice paper pants, some booties, some TED stockings. So they're like flight socks, compression socks, decrease the risk of DVT. A nice hat, colour-coded, whether you've got allergies to any medications, and then a hospital gown.
Like those, so if they have like a pink hat.
It's a nonsense now
Yes.
because basically they'll put a red cap on you, like if you
Allergic to cats, we had that.
if you're allergic to
Not even
eggs,
slightly
they'll put-
relevant
it's
in a
ridiculous.
hospital.
It's
Unusual for a patient
counterproductive.
not
It's
to come in with
counterproductive.
a red hat, because the red hat is
Right.
supposed to be that allergic to something. But since everyone ends up in a red hat, as Richard said, makes
It's
it
like
not
the,
an
the,
alert
the boy
anymore.
who cried wolf. Like if you just keep on making everyone a red cap, everyone just ignores the red cap. I'll add a couple of things to getting ready. Please bring some pajamas or other clothes. I don't want to come in and see you in a hospital gown. It's just, you're not a sick patient. You're having, as Kim said, an elective surgery, and wear something comfortable because we want you to get up and walk around and be mobile. The paper undies, don't wear them. Okay. And I'm going to know if you've watched this podcast because any of my patients going forward, if you're wearing the paper undies, you haven't listened. So if someone gives you paper undies, just say, no, Dr. Bloom said not to wear them.
And
Because
if
I
you
have to take
just-
them off to mark you. So don't wear them. And
The
the
other thing I can say is, one of the hospitals I work at, patients say, I'm having tummy surgery, should I take my undies off? And they're like, no, you'll be fine in your undies.
No.
It's the first thing we do.
I like patients actually wearing their undies. Like the instructions from me are to wear them because I use it to help
Go.
mark where I want the scar for a tummy tuck. So if you're having a tummy tuck or a body lift, wear undies so that I can guide where I put the scar. The last things I've said, so pajamas, no paper undies. The last thing I'd say to bring on the day is your water bottle. Because then you're one of our patients and it makes you cooler than all the other patients. But also it means that you have, and you can control how much you're drinking. So you can start drinking and you need to get through 2 or 3 bottles of that a day to keep your fluids up because we like to get the drips out early. We don't want to be giving you IV fluids.
Yeah, when we're talking about the things to bring to hospital and wear comfy clothing, take off all your jewellery, leave all that at home, several things. You just don't want to be wearing a potential to lose it when you're in surgery and they'll end up putting tape all over you. So leave those things at home.
Piercings as well, out. Don't bring them, don't wear them.
What do you mean?
Thanks, Dave.
Particularly, say, if sometimes I'm doing, say, tummy surgery and someone might have a nipple piercing.
Right.
And it's in the zone where we're prepping. There's a potential with the diathermy, which is what we use to cauterize things, that you can get burns. And then the nurses tape them and who knows what's living under the tape. Just take them out. And you don't want to take them out in the hospital when you're on the trolley because then potential for losing them, things like that. Take them out or put them in a safe place before we see you. And then straight after surgery, you can put them back in. That's fine. But for some reason, and rings as well, particularly if we're operating on your arm, not so much if it's not on your arm. But
Still people like their hands can swell up post-surgery and you don't want your rings to be
Sure.
uncomfortable and tight. The other thing is makeup. You just don't put it on the day of surgery. Other little things like eyelashes. Lots of people have
I'm glad
eyelashes.
you brought that up.
Super common now. It used to be a bit of more of a fuss of thing. But if you're due to get your eyelashes done, don't get them done like the week before surgery. The anaesthetists do take great care when we have your eyes taped when you're having surgery, so to protect your eyes. And so they do take care of the eyelashes, but it's just, don't worry about getting them done. You don't have to look fancy to come to hospital. Nails, nail polish is generally fine. But again, if you're due to have a top up or a touch up, just leave it until you're in your recovery period. And
perfect time to do it.
Yeah.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.